Hi everyone. Today I'll be going over the lesson on mental illness. By the end of today's lesson, you will be able to define mental illness, analyze individual and environmental factors that influence whether a person develops a mental illness, explain how anxiety disorders are different from normal anxiety, and the difference between ADHD, EFDs, and OCD. So, some of you might be surprised to learn that many successful people have mental illnesses. Mental illnesses are surprisingly common and they are also treatable. Almost everyone experiences feelings of anxiety, sadness, and fear. But when these thoughts and feelings decrease mental and emotional health, then they are called mental health conditions. Short term feelings and thoughts that interfere with a person's ability to perform daily tasks are going to be mental distress. Mental illness or mental disorder occurs when mental health conditions do not go away and become so severe that people cannot function in daily life. An example would be a phobia of public places could lead to a person avoid going to work or school. There are some factors that affect mental illness. There's genetic makeup. So, family history of mental illness increases the risk for that condition. Genes influence levels of chemicals in the brain that control mood and feelings. Now, just remember, just because your parents or your grandparents have a mental illness does not mean that you will. It's just going to be a increased risk for that condition. Life experiences and situations like serious brain injuries can increase the risk of mental illnesses, major depressive disorder, anxiety disorders, substance abuse, alcohol or drug use, poor nutrition, and trauma or complications during pregnancy can also increase a baby's risk of developing mental illness later in life. There is traumatic events and stressors can also trigger and develop mental illnesses. So the first one we're going to go over is anxiety disorders. Now, mental illness is characterized by extreme fear or dread that disrupts a person's way of life. There is generalized anxiety disorder, which is they feel extreme and constant anxiety about parts of their lives they cannot control. And then there might be social anxiety disorder, which is anxious about social situations, including meeting new people, eating or drinking in public, and performing in front of others. Social media anxiety disorder, which is a new one, is someone might feel extremely anxious if they cannot check their social media accounts for a period of time. And this may disrupt people's ability to form or maintain healthy relationships and excel academically. Panic disorders are episodes of intense fear characterized by fast heartbeat, dizziness, shaking, trouble breathing, and chest pain. Phobias are extreme, unrealistic fear of an object or situation. Attention deficit hyperactivity disorder, or ADHD, is the difficulty paying attention. Hyperactivity, which is overly active behavior, and impulsiveness. People with ADHD consistently experience symptoms such as difficulty focusing or sitting still, boredom with tasks and activities, difficulty organizing and completing a task, forgetfulness and losing items, nonstop talking, or constant motion. Obsessive compulsive disorder, or OCD, is recurring and uncontrollable thoughts, feelings, and behaviors that make daily functioning difficult. Uncontrollable thoughts are or called obsessions and often cause anxiety. An example of obsession is order and symmetry. People with OCD often try to make obsessions go away by engaging in compulsions or repeated actions. Mood disorders are mental illness that causes serious changes in how people feel. Major depressive disorder is feelings of intense sadness, worthlessness, and hopelessness. Seasonal affective disorder, or SAD, is feelings of worthlessness, extreme tiredness, loss of interest, or irritability in winter months, or in months when there is less natural sunlight. Bipolar disorder is a mood disorder characterized by extreme highs, which is mania, and lows, which is depression. Personality and behavior disorders, category of mental illnesses characterized by consistent patterns of inappropriate behavior. There are many types of personality disorders, and the symptoms interfere with a person's ability to carry out daily life tasks and maintain relationships. Some of them could be antisocial personality disorder, which is a disregard for social rule, borderline personality disorder, which is instability in their self concept and relationships, narcissistic is exaggerated sense of their own importance, obsessive compulsive personality, unhealthy control and perfection, paranoid, extreme paranoia, and schizoid personality disorder, which is a mental illness characterized by irregular thoughts, delusions, and hallucinations. Substance use disorder is a mental illness in which a person continues using a substance despite its negative effects on health and life. Now, there's an order to the substance use disorder. There's experimentation, which is someone just wants to try it. There's regular use, where they continue using and gradually increase the amount. Tolerance is the body's need for an increased amount of substance to experience the effects one once felt with smaller amounts. Dependence is a physical or psychological need of a substance, and then addiction, which is using the substance despite negative effects on health. So now what we're going to do is review what we've just learned in the lesson. So these are also going to be the questions in your Schoology assignment. Question number 1 is, what role do genetics and life experiences play in how mental illness develop? How is anxiety disorder different from everyday anxiety? Describe the difference between ADHD and OCD. Which personality disorder is characterized by extreme shifts in attitudes about other people? Why is it difficult for people with a substance use disorder to stop using a substance? And describe social media anxiety disorders. The answer to number 1 is, people can have a genetic predisposition to certain mental illnesses. Life experiences and situations can trigger the development of a mental illness. Number 2, in an anxiety disorder, anxiety is unrealistic or exaggerated and disrupts daily life. ADHD is characterized by hyperactivity and difficulty paying attention. OCD is characterized by uncontrollable thoughts, feelings, and behaviors. The answer to number 4 is borderline personality disorder. The answer to number 5 is, people with the substance disorder develop physical and psychological dependence on a substance. The answer to number 6 is going to be, they feel extremely anxious if they cannot check their social media accounts for a period of time. It is going to disrupt people's ability to form or maintain healthy relationships and excel academically. So we have reached the end of the lesson, and you should be able to define mental illness, analyze individual and environmental factors that influence whether a person develops a mental illness, explain how anxiety disorders are different from normal anxiety, and the difference between ADHD, EFDs, and OCD. What you're going to do now is head to the Schoology assignment and let me know if you have any questions.